I'm really excited for this week's issue of the three healthcare headlines you need to know from Tallahassee. We have a lot to chat about coming off our trip up to the great north part of the state this week. So I'm looking forward to diving into the program with you. You want to introduce yourself and then I'll do a little bit of intro and kind of tee up today's program.
Sure, that sounds great. It was nice to see you in person, and it was the North. It felt like the North up there in Tallahassee. One morning, I had ice on my windshield, so it did not feel like Florida for a little. But it's good to see the palm trees behind you, so that's kind of makes us feel at home a little bit. But I am Joe Daraskevich. I work for several medical societies and associations across Florida, and we were over in Tallahassee with a bunch of those doctors this week. So we'll touch on that visit a little bit during today's episode, but go ahead. I'll throw it back to you, Fraser.
Yeah, and while we were cold, I know we had a group of doctors up from Miami-Dade County and Broward County as well, so they were really cold for sure. And those are just two of the organizations that we represent. Again, my name's Fraser Cobbe. I'm the executive director of quite a few county and specialty medical societies here in the state of Florida, and we are pleased to come to our audience periodically and talk about those healthcare debates taking place up in Tallahassee and what they need to know from a patient and practice standpoint. So. I think while we're at it, Joe, we should thank all the docs that did take the effort to make it all the way over or up to Tallahassee. They all dedicated a lot of time and energy, and as well as financial resources to get up there and support the cause. So they did a fantastic job. So we greatly appreciate their contributions.
And I just want to jump in, and we know that by going up there, it's taking the doctors away from their practice. It's taking away from their patients for a day or two, and that travel isn't easy either. Some of those doctors coming from South Florida or from Southwest Florida are, planes, trains, and automobiles to get up there. So we're very happy that everybody took the time to go over there. It was very important. And one thing, if you notice, it's cold here again today, so I'm wearing a pullover, but one thing stuck with me was we're not meeting, we're not advocating to one particular party. We're not going just for the blue side or just for the red side. That's why I have the red and the blue on. We're just talking to every legislator we can get a meeting with to advocate for medicine and to talk about, things from the physician perspective. And it goes a long way, and making those relationships is so important. So again, thank you to everyone who came over this week to go to a very important event over there in Tallahassee.
Yeah, and it's definitely appreciated and noticed by the legislators as well. Just about every one of them thanked the physicians for taking the opportunity to leave their practice in their homes and come to Tallahassee and share their stories and their perspectives on what some of these issues mean for them and the profession. So we strive to develop relationships with legislators early on in their career and maintain those relationships throughout. We had a great reception the first night we were up there, where we had legislators from all over the state come and meet with our physician leaders. So again, your efforts are definitely noticed by legislators when you come up. They know you're doing it on your volunteer time and dime, so they really appreciate it.
And there's just an extra, when we heard from several lawmakers who were just kind of saying that, to sit in a room across from an actual physician is there's a little extra gravity when you're in a room with a doctor and kind of hearing firsthand stories from those doctors. So it was a great week, and we're very grateful for all the people who came over. Are
Absolutely.
you ready to
Let's
get
dive
going?
into
Ready to
this.
do our three headlines, Fraser?
Yeah,
All
let's
right, and
dive into
yeah,
the
this first
headlines.
headline, yeah, we'll really touch on all these headlines, but the first one, there was some big news while we were over there, so let's dive right in. Number one today, Fraser, Florida House's big beautiful healthcare frontier bill. Is this innovative reform or a repackaged wish list? What do you think about that?
Yeah, and it was definitely breaking news. It came out of the blue for all of us while we were up there. Certainly there was some folks in the know that knew this was about to drop, but it was fantastic that we were up there when it did. A little bit of kind of timely intervention we could have as well. We did consider calling this the Big Beautiful Podcast, but I think we strayed away from that. We don't want to take anybody's branding inappropriately, you know. But yeah, there's a lot of issues in there. When we had the opportunity to meet with the leadership, they said basically that they heard that a number of legislators wanted to debate a number of issues that they've considered over the years. So I think most importantly, it's a huge bill. It's 144 pages, I do believe. And there's two separate bills, one dealing with more healthcare delivery and the other dealing with more pharmacy benefit issues as well. So it's a mixed bag. A bill that big is always going to have some good and some bad in it. So I do want to state that on the front end. But as far as the bad components, which always grab the headlines first, of course, there's a huge scope of practice expansion embed in that legislation. It would provide autonomous practice basically for every APRN in the state that has advanced training. That would include your CRNAs, your psychiatric nurses, and also let autonomous APRNs go beyond primary care and do all kinds of specialty care as well. So a huge expansion of scope, which is going to grab the headlines for us. There's also some issues around referring patients where the referring physician would be required to tell the patient if they're referring them to a doctor that's out of network. Again, often those networks are that information is not updated, and really we feel that should be the responsibility of the insurance company and the patient to know, who's in network and out of network, since that changes frequently depending on their plan. So those are a couple of the headlines. On the pharmacy side, there's a couple good things in there. One being no formulary switching mid-year, which is great. Many patients choose a healthcare insurance plan based on the medications that they need, and they pick their plan based on the formularies and access, only for insurance companies to switch it mid-year. So this would give patients some protections as well. So the final thought on that is it's only been filed in the House. There's no Senate companion bill for either of the two big legislative vehicles. So we'll kind of see. It's probably an opening salvo from the Speaker of the House on some of his issues he would like to see debated, and we'll kind of see if the Senate takes the debate and where we end up having conversations around some of these issues moving forward.
And I'm glad you mentioned that there's, with a bill that size, there is good and there is bad, and obviously there's a long way to go. We're going to be in our weekly recaps. We're going to probably be talking about this and the developments and the changes and everything. So all I can say is stay tuned. We're going to be focusing on that quite a bit and the months to come. So it was kind of
Yeah,
breaking news where we were in those meetings and it kind of came out and everyone was a little bit surprised. But go ahead. What other thoughts do you have?
yes, some of it too. It's worth noting that there is some economic pressures on the state to expand scope as well. The federal government has this grant program with like $50 billion to states that prove they're expanding access to care. We think it's probably not the right kind of expansion, letting non-physician practitioners practice outside of a physician-led team. But the state has left some money on the table the last several years because their report card shows that they have not expanded scope like some of the other states. So there's some financial pressures on the legislature. So looking at the budget reports or projections for 2 years from now, the state is projecting to have a loss. So there is some financial pressure for the state to try to recoup, pull down some federal dollars to expand scope. So all of that is kind of mixed in this potpourri of debate that we're going to have over the coming weeks and months.
Yeah, there are a lot of angles to this headline. So anyway, we're going to keep our finger on the pulse, and we'll have updates probably every week for as long as we hear about that bill. So we'll talk about it some more. But are you ready to talk about our next headline now, Fraser?
Yep, let's go on to the next one.
All right, number two. What's wrong with the wrongful death bill? What do you think?
All right, we're being creative on that as much as you can with a wrongful death tagline, but so the bill is sailing through the House, and as you know, this is the bill that passed last year, both through the House and Senate, was vetoed by the governor. The House is on the fast track; it's passed its first two committees and ready for the House to take action. So it's pretty much 99.9% guaranteed this bill is going to pass the House, but the bill has not emerged at all over in the Senate. And we had conversations, of course, up in the Senate this week, talking with folks about whether the bill will emerge or not, and it's a bit uncertain at this point. So it may be that the Senate does not want to spend the time and energy passing a bill, only if the governor is going to veto it again. I don't think that dynamic has changed much, so we'll kind of see. We're biding our time. Bills can still emerge between now and the start of session. So we'll see if it pops up here in the next few weeks. But we are hoping, obviously, we oppose that bill unless there's caps on damages included. So we're hoping that either no bill emerges or a bill with reasonable caps gets put on the table there on the Senate side.
It's interesting you bring that up. With the extended session last year, and then the early session that we're going into with 2026, I think people's memories are they remember what happened last year, and so that's kind of a similar song and dance, but they know ultimately what happened with that legislation last year. So it will be interesting. If anything develops, we'll let everybody know about it. But talking to all those different lawmakers over there, they remembered what happened in 2025. So we'll see. We'll just wait and see what develops on that one. Ready for number three?
Yep. Last question of the day.
All right, here we go. Third headline. After a long week, it was a long week over there. We got really important headlines here. Let's jump right in. Number three, is the legislature poised to authorize real healthcare insurance reform? That was a big topic. Is the insurance companies and kind of the big boys versus the David versus Goliath kind of thing. Sometimes when you're in the same room as those insurance companies. So what's the latest on that?
Yeah, and we were definitely rubbing elbows with a number of them. The insurance lobbyists while we were up there for sure. But there is some good news, and at a very high level, it illustrates kind of the pressures that are on, or I guess difficulties patients are having getting treatment authorized. It's not just an impact that our physicians feel as they're trying to get medically necessary care approved through the prior authorization process, but there's real patient impacts, and I think more and more legislators are having personal or constituent experiences with that. There was some discussion about just the vast number of claims that get denied or delayed initially, ultimately only to be approved after a number of weeks or months has passed, and the pressure and strain that puts on patients who are nervous, as well as physicians trying to move these people through the process and get them the care that they need. So anyway, there's quite a few bills that are emerging already, and some that are in the works that will look at reforming the prior authorization process. So just to name a few, I mean, we have the Representative Dean Black has his bill that would eliminate the ability to do retroactive denials. So when the insurance company finally does approve a procedure, we perform it. They can't come back later on and claw back that money after we've rendered that care in good faith. Or if a patient gets on therapy, only to find out later that the insurance company has repealed that authorization, then of course they have to discontinue. They potentially owe the physician money, and of course they don't want to show back up in their office because they have a debt, so they get off therapy. So we definitely support that bill. There's another bill on AI claims handling, which is kind of a new thing that says the insurance companies, if they are going to ultimately deny a claim or treatment authorization, that a human needs to look at that claim. It can't just be all done through AI, which is something that we definitely support. But we heard rumors too of a much larger prior authorization package that may emerge as well. So again, it's an indication that they're hearing the concerns of our physicians and patients that something needs to be done around prior auth. On the AI note, I did note that the president nationally has signed some legislation that really restricts. I think it's actually an executive order I read this morning that restricts the ability of states to enact their own AI laws. So it'll be interesting dynamic here. We got some legislation moving on a state level, but remember we kind of play in this arena too, where the feds have some input also. So we'll see kind of how that plays out over the coming months as well.
We had a couple quick thoughts on that too. AI in general. I was just with some residents last night here in Duval County, and we were talking about the whole trip to Tallahassee and everything like that. And with AI becoming so prevalent nowadays, going over in person and having those meetings in person with the actual legislators is so huge. To see that face-to-face interaction, and who knows, when you're using AI and all the different chat GPTs and things like that, there sometimes can get lost in translation. Am I talking to artificial intelligence? Am I talking to an actual human? And so we're sitting down in these offices during those meetings, and I think that that face-to-face interaction is huge. Secondly, I'm glad you mentioned Representative Black. He kind of, I asked him the other night at a social, because he had met with insurance companies on the same day that he was meeting with the doctors, and I asked him to compare those meetings. And the insurance companies, obviously, they have a lot of money involved. They have people who live there in Tallahassee and who are, there every single day. But Dean Black's the one who told me, it's a little different when you are in a room with a bunch of doctors who are taking a day off from their practice and making that journey. So just wanted to let everybody know that Dean Black's the one who was very appreciative of our time going over there. So anyway, that was a great week, a great trip over there to Tallahassee. And Fraser, any last thoughts before we move on?
No, I'm just thinking we need to get working on an AI rendition of our podcast. So maybe free up some of our time, a little bit more time on the golf course. We could just plug in our notes and let AI kind of deliver this message every week. What do you think, Joe?
Maybe we'll try that. Yeah, I kind of like that idea. I'll play golf in any weather, even if it's cold out. So, we'll see about that idea.
Yep. And one thing we know is machines love music as well. So I think you need to leave the audience with our musical tip of the week as well.
All right, I'll do that. And so we did this last session, and the extended session made for a lot of extra bands and everything. So I decided I'm not going to worry about repeating bands. I'm just going to focus on really good songs, even if I've mentioned the band before. So this is one of my favorite up and coming bands. I saw them last spring in Jacksonville, and they're called Dogs in a Pile. And the song that I'm going to mention is kind of a hat tip to my daughter. Her name's Madeline, and in our family, this is called the Madeline song because there's part of the chorus is all about being out of line and having conversations with Madeline, but the actual title of the song is Burning Daylight. And the reason I'm using another song about my children is when we go over to Tallahassee or to a conference or something like that. My wife is also the managing director of a couple different medical societies, so it's a whole family affair when we go over to places like that. So we were in Tallahassee from Monday to Thursday, and the kids were there with us and everything. So they wake up at all hours. They're crying. They're doing all that kind of stuff, and you always think about who's in the rooms next to us. So if you're watching this podcast and you were in one of the rooms next to us, I just want this song to remind you that little Madeline was the reason for all that noise, and her brother Henry, of course. So you know who you are if you're listening. You were very patient to be next to the Daraskevich room with all of our noisy children and noisy adults as well. So thank you to the doctors, and especially thank you to any doctors who are in hotel rooms right next to me in Tallahassee.
That's great, Joe. Well, hopefully, we wish your family a very happy holidays. I don't know if we're going to do another podcast between Christmas and New Year's, but again, to our audience too, I hope they have a fantastic holiday season too. And again, thanks to the legislators for all they do on our behalf, as well as our physician members for getting up there to Tallahassee. So.